Heart sounds. When valves open, no audible sounds are produced. Sounds are produced when the valves close. Two heart sounds are heard normally through a stethoscope. Closure of valves lead to vibration of valves, which causes vibration of adjacent column of blood and the wall of the heart, which in turn transmitted to chest wall. First heart sound, that is around 0.15 second, it is produced due to the closure of AV valves. It has two components, mitral and tricuspid. It marks the beginning of ventricular systole. When ventricles contract, the intraventricular pressure increases and becomes more than the atrial pressure. This will lead to AV valve closure. Features of the first heart sound are it is low pitched, it is soft because valves are thin and filmy. It is prolonged sound and it is heard as a lub sound. Frequencies around between 25 to 45 Hz and it is heard in mitral and tricuspid area. Second heart sound, duration of which is around 0.12 second. It is produced due to the closure of semilunar valves. It has two components, aortic and pulmonary. Features of second heart sounds are they're short, high pitched, they're heard as a dub sound, frequency is around 15 Hz. The higher frequency is because of the greater elasticity of the semilunar valves. And it is heard over the aortic and pulmonary area. In some persons, second sound may be split due to the asynchronous closure of aortic and pulmonary valves. Usually, aortic valve closes first because of the lower pressure in pulmonary artery and lower ejection time, and split is wide during inspiration. During inspiration, venous return increases due to more negative thoracic pressure. So, stroke volume of right ventricle increases and duration of right ventricular systole prolongs. Third heart sound is 0.1 second. It is produced due to the rapid filling of ventricles. It can be occasionally seen in young adults. The features of third heart sound are it is soft, low pitched. Fourth heart sound. The sound is not heard normally and it is heard best with the bell piece of stethoscope. It is heard just before first heart sound. It is produced due to the rapid ventricular filling due to the atrial contraction and occurs when atrial pressure is high. Murmurs and bruits. Murmurs are abnormal sounds heard over the heart and produced due to the turbulence created at or near a valve or due to abnormal communication within the heart or between great vessels. The major cause of cardiac murmur are diseases of heart valves. Bruits are common. Bruits are abnormal sounds and heard over vessels. Normally, the flow is streamline or laminar, which is silent. When flow exceeds the critical velocity, the flow becomes turbulent and produce sound. When a valve is narrowed or stenosed, velocity of flow increases and the flow becomes turbulent. When a valve is incompetent, blood flows backward through this incompetent valve, which is called as regurgitation or